Well, to the UK now, where a second lockdown appears to be working. This, according to a major study that finds the spread of the virus has been slowing down in Britain. For more, let's bring in Cindy Palm. She's in London right now with more on the story. So, Cindy, good to see you. Tell us a bit more about this study and what came out of it.
Well, Michael, this is a study that came out of Imperial College here in London, and it found that the infection rate has been reduced significantly during the second national lockdown that we're in. So the researchers swabbed 100,000 people in England and noticed this rate of reduction of 1/3. And what is very, very crucial as well is that the reproduction rate, the R rate, is less than 1, which means that each infection spreads to less than one person on average. And this is key in order to reduce the spread of this virus. However, the government says that despite the seemingly good news, the infection rate is still high. It's believed that 1 out of every 100 people have the coronavirus here in this country, and that's about double the number, Michael, that we saw in September, for example, just before this latest increase. And so the Foreign Secretary, Dominic Raab, was asked about what will happen when our national lockdown ends. So this ends officially on Wednesday, and this was his response. Take a listen.
If this process doesn't work and infection rates start to go back up again, are we facing a third wave in January and February?
Well, there's a risk of that if we don't get the balance right. But so far, the R level is coming down. That's really important.
If you don't get the behaviour you want now and through Christmas, we could have another national lockdown early next year.
Well, look, we're doing everything we can to avoid that.
So not really a flat out no by the government. What will happen after this national lockdown ends on Wednesday is that we'll go back to a tiered system in which, depending on the area where you live, the region where you live, and the infection rate there will be different restrictions depending on the area. Michael?
Okay, so we're going to keep an eye out on that. But, we should also talk about vaccines here, Cindy, because, of course, we know various vaccines are showing promising results. But we're now hearing some concern from the UK government that people there will not actually take a vaccine if and when they're approved. So talk about that and what the British government is proposing to do about it.
So the government is concerned that there are people who just simply will refuse to get the jab, or that they are skeptical about the safety and the effectiveness of this vaccine. So they're trying to enlist the help of celebrities and social media influencers to get the word out and convince people that they should get this vaccine, pending approval, of course, by health regulators. They haven't said who they want to enlist yet, but they do say they want to enlist those whom they call sensible, those who have acted sensibly during this pandemic. And they say they want people who are popular and who are well-loved by the public. Michael?
Okay, Cindy, thank you for that. Thank you for that sensible hit. You and I shall speak again later. Cindy Palm in London.